In phase one of the cycle, then we're looking at the menstrual phase, days 1 through 5, roughly an average menstrual cycle. And so our job during that time is just about regulating blood flow. And that means if blood flow is already regulated, there's not a whole lot to do during that time. Just be supportive of the constitution, help the patient to feel as good as they can. We only have to get really involved in the blood phase if there's pathology in the blood phase, if there's severe dysmenorrhea, a history of endometriosis, if there are polyps or fibroids that are causing heavy bleeding, if there are bowel irregularities that are arising, if there are emotional issues that come up during this time, then all of those are reasons why we would think about treatment during this time being specific around either the movement of blood, the warming of the reproductive cavity or the pelvic cavity, whatever it may be. Also on an emotional level, supporting that disappointment and depression and that can arise, and remembering that from a TCM standpoint, emotions also reside in the blood. So it's a time of very heavy emotional pain, especially during a time of trying to conceive, or if there's a pregnancy loss occurring, then that's a very heavy emotional toll that's happening in correspondence with this loss of blood and loss of ballast for the emotion, if you will. And so we just want to support that by encouraging foods that nourish the blood, getting adequate rest, staying warm, doing all the things that we already know how to do to support them, but just remembering that some of the emotional upheaval comes from the discomfort of actually losing some of the material that houses those emotions and gives us a little bit more ability to regulate them. In the second phase, then, or the follicular phase, the proliferative phase, were what we would typically call the yin phase of the cycle. So the goal is then, if there is a need, we would be stimulating estrogen to help build yin. So the endometrial lining, the growth and development of the follicle or follicles, in the case of a medicated cycle. And we could also sort of look at this as the Renmai phase of the cycle, because it's the yin phase. So it's about things are growing, lining is getting thicker, follicles are getting filled with fluid and they're getting larger. So the Renmai phase or the yin phase sort of correspond with one another. Now, if you have a patient who doesn't have any trouble during this phase, who has a easy as pie 5-day period and an enjoyable follicular phase and ovulates easily, then you are just supporting their constitution during this time. There's nothing really to fix, right? So you don't have to start giving them yin tonics or things that are going to impact their yin if it's not necessary, if it's not indicated. Phase 3 is the ovulatory phase, which typically occurs around day 14 or 15, though patients typically get a surge, which would be that chi surge, a day or two before ovulation. And this is that transition we were talking about from yin to yang. It requires chi for that transformation to take place. So depending on the patient's constitution, looking at using the Ren and the Chong together, or the Ren and the Du together to kind of overlay that, that microcosmic orbit, hypothalamic HPOA axis. Sometimes the Ren and the Du is really helpful when patients struggle with making that yin to yang transition. If it's just a matter of chi deficiency, then maybe the Renmai and the Chongmai, because they have so much resonance around that. So we're talking about putting together two Cs, not necessarily having to move, into the second ancestry, but focusing on the Sea of Yin and the Sea of Yuan Qi or the Sea of Yang. However, you'll see shortly when we start going into some protocols that engaging the microcosmic orbit, I actually do usually also use the transporters that go with the Ren and the Dumai. So the fourth phase is the ludial phase. And so that's, we discussed, it's the hyperthermic phase. The body is warmer because of the production of progesterone. And so we want to maintain the yang, sustain the warmth in the system, not allow for yang to leak out. You can support through that sort of undifferentiated source chi of the Changmai during this phase, and you may decide to incorporate the Dumai if there really is difficulty with maintaining progesterone levels, maintaining adequate yang in the body. And if there's a lot of anxiety or anxiety that is just, peaking or getting, worse and worse as the end of the cycle progresses, then the yin way is very, very useful here for that kind of emotional distress that is just so heart oriented, anxiety, waking up in the middle of the night, palpitations, can't allow oneself to ground and relax because there's so much fear about what's coming. Then incorporating the yin way there is very helpful. And then this phase that I call phase 4+ is the premenstrual phase, which is that window of time where there is not a period yet, but there's already a negative pregnancy test. So the patient knows they're not pregnant. They may have been on progesterone supplements. So we're looking at least 5 days from that withdrawal of progesterone until most people will bleed. Sometimes it's sooner. And so this is a very intense time of heightened emotional duress for people who were in a 2-week wait. Now the 2-week wait is being, even though it's not a positive test, it's being extended because they haven't begun their period yet, but they know that they are not pregnant. So you definitely want to just create a lot of circulation during that time of qi and blood to help move the menses along, help that to start as soon as possible. Sort of a modified ovulation treatment, which we'll talk about in a little bit here, but a similar energetic where we're trying to create a transformation, this time from yang to yin, as opposed to from yin to yang in the ovulatory phase. And the Chang and the Renmai are beneficial here with points for pain that are on the trajectory, points to help with blood flow and to support the emotions.